Today on Investigate TV Plus Weekend, same test, same insurance, but a tenfold increase in cost. We uncover how a cross-country move turned one woman's routine MRI into a billing shock and why it could happen to anyone.
But then, moving out here, I just assumed it would be the same.
And what was the price change?
So out here, it was $12,000.
Plus, they're being called life-changing, even life-saving. But for many, the promise of powerful new weight loss drugs comes with an unimaginable price.
It's ultimately me deciding, am I going to have a place to stay for me and my kids, or am I going to pay for this medication?
And a breast cancer diagnosis doesn't just affect the body, it upends every part of your life. Now, new tech offers some comfort through treatment.
You go through anger, you go through denial, you go through, oh, I'm gonna fight this, I'm gonna beat this, and then you have your bad and good days.
Investigate TV Plus Weekend starts right now. Hello and welcome to Investigate TV Plus Weekend. I'm Lee Zurich. For many people at high risk of developing breast cancer, getting an MRI can be life-saving. But one woman learned that moving from one state to another and going to a different facility can be costly, even with the same insurance provider. Our Caresse Jackman examines why this happens to patients across the country and what you can do to price compare.
A new peaceful beachside hometown for Kelly Reardon.
So I've lived here about a little over 2 years. We just really feel like we're really part of the community out here.
Came with an unexpected surprise.
Well, I was actually shocked when I got it.
When she started paying for diagnostic tests that have become part of her healthcare routine.
And so I was calling family members and hey, is this normal? Is this right? And they're like, yeah, that's, it's high, but it's worth it.
The change in scenery from Alabama to North Carolina came with a major change in Kelly Reardon's healthcare bills for an annual breast MRI. Something she says isn't optional, but potentially life-saving.
So I'm high risk for breast cancer. So my mom died at 48. So I'm definitely dense breast, but most women have that anyways. So definitely categorized as high risk. So just being checked every 6 months is super important, especially for me and everybody else in my family.
When Reardon lived in Alabama, she says she received her MRI at an imaging center and was billed around $1,100. Her out-of-pocket cost totaled around $650.
But then, moving out here, I just assumed it would be the same. Knowing hospitals are maybe a little bit more just because it's a different type of facility, but didn't expect quite the price change that I experienced with it.
And what was the price change?
So out here it was $12,000. So I was like, oh, okay, no big deal. They made a mistake with billing. They accidentally added a zero.
But it wasn't a mistake. Reardon went from being billed around $650 out of pocket to over $6,000. Consumer medical experts say that's because instead of going to an imaging center, Reardon received her MRI in North Carolina at a hospital facility. For both procedures, Reardon was in-network, received prior authorization, and had the same insurance. She expected the price to fluctuate somewhat, but not this much.
I work in pharmacy, so pharmacy bills real time. So when you come to the pharmacy and you pick up a prescription, that's the price that you pay. There's no back billing. You don't get a bill that says, hey, now you owe an extra $1,000. With medical care, it's all billed after the fact. So I was probably 6 months later that I got this $6,000 bill because it's all back billed.
Unfortunately, before you get care, we don't often know how much it will cost. Unlike any other product you would buy where you know the price tag, more often than not, before a procedure, you don't know.
Kay Pastena is a vice president at KFF in Washington, D.C., a nonprofit health policy research, polling, and news organization.
For private insurance, each employer, each insurer has a negotiated rate with each provider. They have their own provider rate. And that's not often very transparent to patients.
Pastena says where you get your care can make a difference.
Most patients don't know you're often paying more to get that care at a hospital setting because of what are called facility fees. I'm not sure if that's the case in this particular scenario, but often a hospital is going to charge you an extra fee.
Where Reardon now lives, there aren't many options nearby.
An imaging center is not even within 20 miles, 30 miles from you, right?
Yeah, I mean 100, 120. I mean, you're talking about driving to Raleigh, which is 4.5 hours from here.
Our team showed the pricing differences to Patricia Kelmar, Senior Director of Healthcare Campaigns at U.S. Public Interest Research Group, or PIRG.
When you saw the difference, I mean, what went on in your head? What did you think?
So there's significant differences. I mean, $10,000, that is a lot of money. And it's important also for our insurance companies, right? We don't want our insurance companies paying 5 times the amount just because it was done in a hospital setting. And so you have to ask that question. You have to ask for the prices up front.
One way of doing that, Kelmar says, is looking on the center or facility's website for a price estimator.
See if the bill is even close to what they're telling you they're going to charge you. That's a point of negotiation that you could have. It is the law that every hospital put on their website information about prices for the services that they offer. If you can't find that, call them up and ask for it.
Reardon's hospital did not comment on her specific case, but told our investigative team it's important to note that the prices reflected in these estimator tools may not encompass all costs associated with the service and may differ from the actual cost. They added that they recognize the complexity of healthcare pricing and support patients with their billing needs. There are moves in the works to try to make prices more transparent, specifically when it comes to receiving what's called an advanced explanation of benefits, or
AEOB. I think most of us who are consumers know that we get this thing called an EOB. It says this is not a bill from our insurer, and it tells us how much we have to pay out of pocket after we get the service. Federal law will require you get that notice before, but that hasn't yet been implemented. So patients are still kind of on their own to figure out the costs beforehand.
And there is a bill proposed that would eliminate out-of-pocket costs for people like Reardon. The Find It Early Act would provide health coverage with no cost sharing for additional breast screenings for people at greater risk for breast cancer.
Yeah, that would be great. I mean, if this is something that I guess it eventually comes down to our government decides is an important thing to help protect the women. I feel like a lot of times women's health or women's health in general kind of lags in care.
Reardon is now on a payment plan, but she worries for other women who are high risk, who aren't as fortunate.
I just feel for people that aren't as lucky as I am. I do have a good job. I have a company that helps pay for healthcare. I have people that I can talk to. To be somebody that just doesn't know anything, like, it just makes me really feel for people out there that just get the bill, and then, some people that could be the last straw for them.
Reardon's hospital added that in general, care within a hospital may be subject to facility fees, which cover the cost of hospital-based resources, staff, and infrastructure, all of which support patient care.
Have your bad days, but understand we need to pick yourself out, brush yourself off, and that next day know that it's a new day. Don't let it define you.
Chances are you know someone affected by breast cancer, the most common cancer in women worldwide. Up next, the new technology empowering patients, offering care, comfort, and control from their own homes. According to the American Cancer Society, this year in the U.S. alone, doctors will diagnose an estimated 316,000 women with invasive breast cancer. Treatments can be intense and often come with painful side effects. Our Heather Graff shows us how new technology is helping patients cope with the physical and emotional toll, offering vital support during treatment and into recovery.
Michelle Apple has always loved lifting weights. But the biggest test of her strength was a breast cancer diagnosis.
You go through anger, you go through denial, you go through, I'm going to fight this, I'm going to beat this, and then you have your bad and good days.
Michelle says doctors misdiagnosed her when she found a lump under her armpit. But after her mother died from breast cancer, she returned to the doctor.
I ended up finding out that I was stage 3. I had 23 lymph nodes cancerous, mastectomy, had my ovaries removed, and then in addition to that, I had, months of radiation and chemo.
Michelle is one of an estimated 4 million women in the U.S. living with or beyond invasive breast cancer. It's the second deadliest cancer among women, which has doctors developing high-tech solutions like a wearable ultrasound.
It's a device that is connected to a bra that a patient can wear, and then there's an ultrasound transducer that's connected to the bra.
Developed by MIT, the tech allows the wearer to take ultrasound images of their breast in the comfort of their own home.
And then they can take another picture the next day or the next week, and then the software will compare the pictures.
Breast cancer surgeon Dr. John Bumberry says the device is for women who have a high risk of developing cancer.
And they're getting close follow-up as it is. And close follow-up usually means we see them every 6 months or so.
And his hospital is home to another treatment showing early promise, this time for its ability to treat the painful side effects of radiation.
Can you imagine being sunburnt for 5 weeks and then having it get worse for a week or two after the radiation's done, and it's still not completely resolved until about 4 to 6 weeks after the radiation?
Mercy Hospital in Springfield, Missouri is part of clinical trials treating radiation burns with a bandage called Mepitel. Typically used as a wound dressing, doctors say Mepitel is showing encouraging results among patients getting radiation.
So far, none of my patients who've gotten the Mepitel have had any skin breakdown.
Including Lynn Lee, who saw positive effects of her own.
They asked if I'd be interested. I said, absolutely. I mean, if it would potentially help any radiation effects, why not? And if being in the clinical trial would benefit other women, there's no downside. And plus, it doesn't hurt.
Back at the gym,
Keep up the good work.
Michelle is now treating people battling breast cancer in a different way. In 2019, she started the Apple Warrior Breast Cancer Foundation.
We help pay for travel expenses and also medical bills that aren't covered through, obviously, insurance. And what we do is, as long as the funding is there, we help where we can help.
Her ultimate mission,
don't let it define you. Push forward.
Is to give her fellow breast cancer survivors hope to carry on.
Have your bad days, but understand you need to pick yourself out, brush yourself off, and that next day know that it's a new day. Don't let it define you, but let it inspire you to help others.
Doctors at Mercy Hospital say Mepitel is being tested in a clinical trial so it can be available to more patients. The goal, to get it FDA approved to treat breast cancer radiation so insurance will cover the bandage. As for the wearable ultrasound, our team was told it's undergoing clinical trials and is expected to be available in 4 to 5 years. Coming up, a mother's fight to stay healthy highlights a growing struggle for people across the country. We examine the steep cost of breakthrough weight loss drugs and the push to make them more accessible for those who need them most. Nearly half of all Americans are living with obesity, the second leading cause of preventable death after smoking. While there's no magic fix, experts and patients say a new class of medications like Wegovy and Zepbound is showing real promise. These drugs curb appetite and food intake and have been hailed as not only life-changing but also life-saving. Access, however, remains a major barrier. Many insurance plans don't cover them for weight loss alone, and the out-of-pocket costs can be staggering. Heather Graff returns to show us what that means for patients and what's being done to change it.
For a long time, I was on a upward scale of just gaining weight.
For North Carolina mom Kiana Price, trying to stay healthy has been a lifelong battle.
And I remember seeing a picture of myself that someone else had took, and I was like, oh my God, I can't believe I had gotten that big.
The reality of what she saw terrified her, not because of how she looked, but how she felt. Kiana is pre-diabetic with a family history of diabetes.
It's a trickle-down effect, and I'm really trying to stop and not get to that place.
Over the years, she tried managing her weight with diet and exercise, but nothing was working. Not until 2023, that is, when she started taking a relatively new weight loss drug called Wegovy.
I was losing weight, my A1C had came down, I felt a lot better, I was doing a lot better.
Kiana lost about 60 pounds in a year.
This was the most consistent weight loss I had ever seen for the longest period of time.
Wegovy is part of a class of medications called GLP-1 agonists that work by reducing blood sugar levels.
And they also interact with appetite hormones to lower and suppress appetite.
Clinical trials have shown patients can lose more than 10% of their body weight. And according to University of Pennsylvania cardiologist Dr. Lauren Eberly, the results are compounded over time.
These medicines really have also been shown to lower your risk of a heart attack, risk of a stroke, and improve quality of life in certain types of heart failure. So there's really tremendous benefit.
While GLP-1 medications are typically covered for type 2 diabetes patients, insurance coverage can be harder to come by for those strictly overweight and treating obesity. In fact, according to a recent JP Morgan survey, less than half of employers offer coverage for weight loss management alone, and current laws prohibit Medicare from doing so.
How frustrating is all of this?
It's very frustrating.
In April 2024, Kiana's health plan stopped covering GLP-1 medications that had been prescribed for weight loss, citing cost. She had been paying $25 a month for Wegovy and was now looking at more than $1,000 out of pocket.
It's ultimately me deciding, am I gonna have a place to stay for me and my kids, or am I going to pay for this medication? And I just knew that wasn't an option.
Cost is a common threat among GLP-1 medications in the United States.
People are going into debt. People are putting this stuff on credit cards because they're so desperate.
Weight loss specialist Dr. Janice Laster has spent years advocating for more widespread availability.
What are the cost comparisons covered from insurance versus not covered?
Oh, it's huge. If it's not covered, they can be upwards of $2,000 a month. If it is covered, it's from $0 to $25 a month.
At the federal level, efforts are underway to help remove the price barrier. A bipartisan bill was introduced on Capitol Hill in 2023 that would allow Medicare to cover FDA-approved obesity medications. It's called the Treat and Reduce Obesity Act, and Laster says it would be an important step because Medicare often influences private insurance as well.
It feels very wrong that patients that really need it don't have access.
A similar measure was proposed in late 2024 by the then Biden administration.
What would you say to lawmakers if you had them sitting right here?
I need for you guys to get to work. Some people are fighting for their lives, and this is helping them in that fight.
Senator Bernie Sanders has been vocal about the need to get weight loss drug pricing under control.
If not made affordable, Americans throughout this country will needlessly die and suffer.
In September 2024, he grilled the CEO of Wegovy maker Novo Nordisk at a Senate hearing.
From a moral perspective, does it bother you knowing that keeping the price of Ozempic and Wegovy so high in the United States could lead to the preventable deaths of tens of thousands of Americans?
So, Senator, we are very committed to make sure that Americans have access at affordable price point for our medicines.
Novo Nordisk representatives declined to speak on camera, but provided a statement saying in part, "We look forward to continuing to work with policymakers and other stakeholders toward meaningful solutions for the people who rely on our medicines." Meanwhile, a recent study led by researchers at Yale and the University of Florida says expanding access in the country could prevent more than 40,000 deaths a year.
These medicines are just tremendously effective, much more so than, all of our recommendations that we can make, for exercise and diet changes.
What do I have in my pantry?
But for many, consistency is key, because research shows that weight regain is common when patients stop taking GLP-1 medications, particularly when it's abrupt.
Since I've been off the medication, my weight has gone back up. I feel like I'm reverting back to the beginning of this whole journey, and I don't want to go back there.
Kiana says she's taking her weight loss journey one day at a time.
Trying to stay in the gym, stay motivated to do it on my own, but it's been tough.
That's why she seeks out motivation any way she can.
Whatever the problem is, the answer is not in the fridge.
Because for this mother, failure isn't an option.
I want to be here to see them graduate from school. I want to be here when they start their families. And if I don't do something now to turn this around, it's not going to happen.
For those without insurance coverage, there are several ways you could save on weight loss drugs, including patient assistance programs, savings cards, and health savings accounts. According to drug makers, common side effects of these medications include nausea and abdominal pain. After the break, they might sound urgent, but not every debt collection call is what it seems. We show you how to spot a scam, protect your credit, and to take control of the conversation before you pay a penny. Debt collector calls can be overwhelming, but acting too fast can do more harm than good. Experts say your best first step is to ask questions, verify the debt, and make sure the call is even legitimate. Reporter Rachel DePompa shows why knowing your rights can help you avoid costly mistakes in this week's Watching Your Wallet.
There's no doubt calls from debt collectors can be very stressful and overwhelming. And your first instinct might be to hide from them and not answer the call. But Leslie Tain, a debt relief attorney with years of experience, says don't hide. Try to face this head on. And if you're not sure why they're calling, ask a lot of questions.
Don't be afraid to say, who are you, where are you calling from, and what the purpose of the call is. If you're still unsure or they're asking you for personal information to verify certain details, you can ask them for a phone number. You can look them up yourself online, do a little independent research to make sure that it's legitimate and not a scam.
Tain says you can also ask for a validation letter to be sent to you to validate the debt. That's making sure this is debt you actually owe, or to see if it's an old debt that's already been resolved and there's some sort of mistake.
If you hide from a debt collector, that doesn't mean that they go away. Even if things get quiet for a few weeks or a few months, that could be because they're preparing to sue you or to send additional debt collection efforts after you. If they sue you and you ignore that and you end up with a judgment against you, you could find that your bank accounts get frozen, your wages get garnished, or they could seize other assets and make life really difficult.
Tain says allowing a debt collector to continue to contact you over time on a valid debt can impact your credit negatively. She also says you can seek help from an experienced debt resolution attorney or even a trusted advisor to ensure your rights are protected and that your debt is resolved.
And that's it for us. Thanks for joining us here on Investigate TV Plus Weekend.